that's looking at the data. That's looking at how we can use data for good. And we think about retention results, engagement results, folks engaging in the social belonging and really connecting your values to the folks that, again, are caring for the smallest patients during the life's toughest times. Our job is to make sure that they're taken care of so they can take care of others. Because quite frankly, folks in healthcare, they take care of others before they take care of themselves. Welcome, everybody, to the Navigate People First podcast. I'm Troy Vincent, joined by my co-host and Chief Technology Officer, Jeremy Knipper. Jay, good to see you.
Thank you. Great to be here.
Children's Nebraska is known for its mission to improve the life of every child, guided by the ICARE values of innovation, collaboration, accountability, respect, and excellence. What makes today's conversation special is that these values extend beyond patient care into how they support their own people. On this episode, we'll explore how Sarah Wheeler, the Corporate Wellness Program Manager at Children's Nebraska, and her team built a well-being program that lives out that mission internally, fostering purpose, joy, and belonging for every employee. Sarah, welcome to the show. How you doing today?
Thank you for that warm welcome, Troy. I am doing well. I'm excited to be here and chat with you guys today.
We're so happy to have you with us today because when we think about who you care for, the people that you work with every single day are those that stand beside our littlest patients and families during the most difficult times of their lives. And I just kind of wanted to get started with, maybe your journey into well-being. So maybe, Sarah, give the audience a little bit of background about your personal journey and what drew you into the field of well-being.
Absolutely. So I went to school for health and exercise science. So I have my bachelor's and master's in those. Originally, I was planning on doing more athletic coaching side of things, but ended up with a job out of college in campus recreation at the University of Nebraska, which is how I ended up here in Nebraska. From that job, I moved kind of more towards the corporate well-being side and worked for a manufacturing company. And then in the middle of COVID, I moved to children's, which was quite an interesting transition. Went from a more male-dominated field to a female-dominated field. In the middle of the pandemic, we had a huge need for well-being, and I got the pleasure of essentially starting our wellness programming from scratch in 2021 at Children's.
So, Sarah, your well-being and benefit structure spans emotional, social, financial, physical, and community well-being. How did you design this program from scratch with that holistic mindset?
So the benefit of getting to start it from scratch was we could immediately meet our people where they're at, right? We didn't have 20 years of history where we had to kind of fight against, we've always done it this way. And, we were able to start from square one, day one, say, okay, what's happening in COVID? What support do our people need right now? And we can immediately pivot and provide that to them. As we were thinking about what we wanted to do plan design wise, I also wanted to be really intentional that we were holistic. When you're creating a new well-being program, some people think well-being, initially, especially pre-COVID, they would think step challenges and losing weight, more of that physical well-being piece. Obviously, that did change a little bit with COVID, but I really wanted to put an emphasis on that mental health piece, on the financial well-being piece, on the community piece, on building social connections, because we know that all of those pieces are important. It's not just my physical health day to day. And so with that, we were able to craft a program that is for everyone, regardless of your health goals.
Sarah, you have a wonderful wellness team that is there. Maybe talk about the importance of that on-site presence or the accessibility of your team when it comes to those dimensions and how they're assisting with that connection and that journey.
Yeah, so that's really one of the unique things about our program is that we have subject matter experts for each of our dimensions. So I oversee our physical well-being piece of it because of my background. I also see our paid volunteering time off program, that community piece. We have David Husky, who oversees our emotional piece, and he has a background as a chaplain and was already providing that mental health support through our peer support program. We have Madeline Quinn, who has a background in nursing and has been with Children's for many, many years. And she oversees our recognition and social well-being program. And then Rebecca Crawford, who is our benefits and compensation manager, oversees that financial well-being aspect.
Jay, when you see a team like that, or you hear about a team like that, it kind of brings me to the engagement equation of all the variables that we're able to kind of put in that ROI and the value that we bring. Maybe touch on that, on what you've seen in their program and other programs throughout the country.
Well, I think what we're finding out, and I'm sure Sarah can testify to this, is that more holistic programs tend to get better engagement. It's not a hard and fast rule, but they tend to be more invested in the lives of their employees and looking to make sure that we're reinforcing activities that are already taking place and introducing people to new concepts that aren't things that have huge barriers to entry as well, right? Like starting a physical activity lifestyle change can be pretty daunting for a lot of people. Same thing with starting a nutrition journey. But getting active into a mental health journey or focusing on your finances, all of those things could be something that's much more attainable, much more sort of immediate to a person's needs. So we see higher rates of engagement across the board with holistic programs, simply because participants find ways to get involved where they might not have been in the past. It's a lot of participants give us the feedback that it's refreshing that there's so many opportunities to get involved. And the more engagement you see, the more value you as a client, you as an organization are going to find with your programming. You're going to have happier participants, you're going to have healthier participants, and you're going to see, behavior change that is higher than what you're spending on your programming in general.
I think about Children's Nebraska's mission around improving the life of every child. And you guys have a very people first promise emphasis when it comes to what you guys do. And when I think about that, I wonder, is there a particular component that your employees gravitated toward that maybe surprised you, or that you really wanted to lean in on?
Well, we had such a heavy focus on that mental health support for so long that we've actually seen a swing back to our physical well-being resources. People saying, hey, I want more help with nutrition. Hey, I want more help with moving my body, things like that. So that was a little bit of a surprise, or maybe it means I've just been in well-being for so long. I've seen the full trend cycle, because that was traditionally what it used to be. And then, we were always saying, hey, mental health is so important. And then COVID happened. So it brought it up to the top. And then now it's come back around. But, Troy, I think all of them are so important. Like people have different needs at different times in their life. And so we've seen a pretty steady need for all of our different dimensions of well-being because, hey, for this phase of your life, you might need this support, but then next year you're going to have this life event and you're going to need this one over here. So I would say that there's been a pretty strong demand for all of them, just because they all support people in different ways and kind of overlap and impact different areas of your life.
Hey, Sarah, maybe share an example of how family and community values have been woven into your program.
Yeah, so I would say family is woven in through our social well-being dimension. We have very intentionally brought family into the hospital and into our events. So one example is Maddie does a day in the life event where we bring in family, friends, whoever you would like to come in with you to see what it looks like behind the scenes of a hospital. So there's simulation patient rooms set up. We have the ambulance out. And it allows the healthcare workers to feel seen and understood by the people that they love, because they can kind of be tricky, right? Because normally you wouldn't get to see behind the scenes of a hospital just because of the nature of what is happening and what's going on. And so we have the unique opportunity to essentially break down those walls. So that way healthcare workers can really kind of show off what we get to do every day. We also have a huge focus on community through our paid volunteering program. So each employee gets 8 hours of paid volunteering time per year. And this is meant to be during their normal work day. So we're not asking you to go above and beyond working, at night or on the weekends, but we want it to be integrated into your normal schedule. But we've been really intentional with the organizations that we are working with so that it is almost a two-way street. We are helping them, but they are also helping our people understand what situations maybe patients and their families are coming through our doors with so that there can be more empathy there. But then also, we're referring our patients to a lot of these nonprofit organizations. And so it's almost helping them have a warmer handoff. So you can say, hey, I'm going to refer you here, but I know so-and-so here, and here's going to be what your experience is, versus just kind of giving them a phone number and it being a little bit more of a cold handoff. So those programs have been so impactful. We've really seen the data to support that. We do feedback surveys and measure different things, and people have been very appreciative of all of our social events that we have, as well as that community benefit.
Oh, that's awesome. Speaking of impact, the Wellbeing Committee, the concept in general and specifically at your organization, can you talk a little bit about how that group supplements and enhances what you and your team are able to do and the program itself?
Yeah, so we have a whole network of well-being champions throughout our organization. We ask for representatives from any team or department or area, anybody that is engaged and wants to impact well-being. We also have 2 medical directors of well-being, and they are really our bridge to our providers or our doctor side, to be able to give that feedback to us as well as communicate things out. And really the goal with our champion network is that personalized communication. We've talked a lot about that personalization aspect and meeting people where they're at. We know that if there is someone on your team that you know and trust, you're more likely to go to them as that resource, versus them trying to remember, who's that girl that does well-being and let me find her contact information. You have your resource and expert right on your team. And that person can, be providing those reminders and that constant communication and those nudges to engage with the program. And then also provide us feedback as far as, hey, this part was confusing, or hey, this wasn't working, or we really love this. Let's see more of this. So it's essentially that bridge of communication for us.
And they're building such a culture of belonging when you think about your employee resource groups, your volunteer time, your family connection. Jay, we're seeing more and more of these opportunities to amplify a well-being program by incorporating those inside initiatives, incentives, inside the program design. Maybe touch on that a little bit of like that configuration that really matches culture, care, and clinical across our entire spectrum of how we're helping people.
Well, the first thing I would say is an interesting story with us when it comes to giving back in general, right? Especially at the organization level, and that we saw more and more people doing it. And in turn, we saw the programs that are doing that are more and more successful. People love to have that feeling that they're doing something good, either to their coworkers or to people in the community or friends and family. We've actually gotten to the point where we've got the data to back up that a program will be more successful if it incorporates an aspect of giving back to it, whether that be as part of the incentive design, whether that be just volunteerism, however you want to do it at your organization, whatever fits your culture. And that aligns with that message where you need to have a continuum of well-being that stems all the way from the culture of your organization to medically and clinically taking care of everybody and all aspects in between. And we've found that volunteerism and giving back is a great way to bridge some of that cultural to care aspect of programming.
Perfect example how Children's Nebraska grounds their well-being program in their value system of their people first mentality. When I think about that, you're also getting results when it comes to your recognition programs, maybe your Daisy Award scores. Maybe, Sarah, touch on that, even on retention, perhaps, of the results that you're getting when it comes to that engagement inside your program.
One of the hardest parts I feel like is determining that ROI or figuring out what data to track. We've actually seen a 35% turnover reduction despite growing by 31% since 2021. And then in addition to that, our engagement index has grown by 26.7 points for our team members, which is huge. That is drastically above benchmark for healthcare across the board. Even just in healthcare in general, there's a huge labor shortage with retention numbers far below that. And so for Children's Nebraska to be leading the way, I think is a true testament to the impact of focusing on culture and focusing on well-being and taking care of your employees.
Especially when you started it from the ground up, just being able to do this and build this program from the ground up.
Not that many years ago
either. And I would say stay tuned for a case study coming down the pike in the next couple months here. Sarah, one of the things that you talk about is that your workforce, 85% women. When you think about how you're addressing the needs of the majority of your population, are there particular things that you're focused on, or maybe touch on how you're supporting those employees at your hospital?
So we have recently implemented ICARE, which is a fertility benefit. It also covers things like doulas and some postpartum support there. I think the next frontier for us is going to be looking at menopause and how do we support women with menopause. I will say that is, seems to be kind of an up and coming thing. I don't know that we've necessarily figured out what that looks like, but I'm excited to start to tap into that and start the conversation in helping those women feel more comfortable at work and looking at how we can best support them.
Sarah, we've talked about radical flexibility in healthcare. Perhaps explain to the audience what that means to your organization and how it shows up in practice.
The radical flexibility has been huge for us, and especially with COVID, that how you work has changed so much. For example, I'm working from home today, which is a great benefit because I have a sick kiddo at home. But we had to look at, what does that look like when you have a hospital that runs 24/7 and patients that need 24/7 care, and how do you still offer flexibility within roles that traditionally have not had a whole lot of flexibility. And so we've looked at and implemented, what does it look like to maybe work for 9 months out of the year while we're in our busy surge season, and then have 3 months off over the summer where we're typically less busy and you can spend time with your kids. Or another option is we have implemented someone who just comes on for a few hours and does breaks for lunch. And so they're just kind of working, a few hours in the middle of the day, and they can drop their kids off at school and pick them up at the end of the day. Or offering people flexible working hours, and just having the ability for people to work one-on-one with their manager and figure out what works best for their life, I think has really helped us retain people. And by being more flexible and meeting people in the phase of the life that they're at, we're able to help them improve their well-being and just really show that we care and we see you as a person. You're not just another number.
Love that.
That was awesome, by the way. Well done.
Sarah, maybe you could help us understand some of the ways that Navigate has supported your journey.
So Navigate has been really great because we are spread out. We have clinics everywhere. We have people working all different shifts. We have people working in different states now with remote work. And so one of the benefits of Navigate is that it could reach people wherever they're at. It's not limited to where can I the Wellbeing manager go, or where can David and Howie, our four-legged friend, go? And so having that access to people, that people can log in anytime and participate, has really been great. For example, the challenges right now, we are in a step challenge against another healthcare system, and everyone can participate, regardless of what shift they're working on, where they're located. It kind of brings us all together towards that one goal. We also love our account manager, Lindsay. She gets us all the things that we need and is so quick. I also really appreciate just the flexibility in what our platform looks like, and the openness to work with us on, if we say, hey, can we move this around to make this, more prominent on the top, or hey, people really aren't understanding this message. How can we reword this differently? It's not a one size fits all, but we're willing to work with you to figure out what you need to meet the needs of your organization. I also really love the data and the dashboard piece. And that's something that we've strategically been looking at this year, is how do we start utilizing that data to its full extent, so that way we can continue to improve our programs and show those outcomes. We are looking at trying to match our claims data, hopefully to be able to better target people in the future and match it with our well-being data to show, hey, this is really working. It is impacting our bottom line, to just show the importance and the value of what the platform is providing to ensure that longevity of the program.
Well, thanks for the kind words.
Yeah. And I don't know if you saw Jeremy smile when you saw integrate claims data into your program and look at that, cheers to that. But that's looking at the data. That's looking at how we can use data for good. And we think about retention results, engagement results, folks engaging in the social belonging and really connecting your values to the folks that, again, are caring for the smallest patients during the life's toughest times. Our job is to make sure that they're taken care of so they can take care of others. Because quite frankly, folks in healthcare, they take care of others before they take care of themselves. It's fair to say, Sarah?
You hit the nail on the head, Troy. I say it all the time. Like, that is what I do, is I help them take care of themselves so that they can take care of everybody else.
I love it. We always like to end with our best day ever segment here. So, Sarah, maybe lead us, maybe something, give us a good that's happened in your professional career or family, just to end on a good.
Yeah. So we got to go to the apple orchard this past weekend, and fall is my favorite season. I love doing all the fall events, all the fall foods. So it was the opening weekend. We got to go pick some Honeycrisp apples, ride the hayrack ride, have an apple donut and apple slushy. So life is good here.
Love it.
Uh,
Apple slushy.
I jotted that down. I was like, I got to try an apple slushy. I've never had that.
Oh, they're delicious.
Jay, what do you got?
So as people who listen to this podcast know, my wife is a teacher, and one of her former students, is now playing at a major university and had a heck of a football game this weekend. And it was just delightful to see her lighting up about it, the kid being, nervous and proud and excited, and the whole community sort of texting everybody else and trying to get the details and sharing that celebration. So, being able to be a part of that, even ancillarily, was really just a nice experience.
Love it when Iowa kids do good. Love it. School's back in session. We get a little routines back in, and love it. I get, my best day ever is just really, I love seeing the impact of our work reach all the dedicated people that are caring for, again, our smallest patients and taking care of those folks during those toughest moments. I love seeing that we're supporting Sarah and her team and those people, and we're part of something bigger and Navigate and helping those that are helping children and families when they need it the most. As a founder, man, it doesn't get any better than that. I love it. So, I just appreciate all that you do, allowing us to work with you and dedicating yourself to helping others and And everybody that's listening in HR, we appreciate you. We appreciate all that you do for others. Continue to do that. Continue to like and subscribe to our podcast. And please let us know if we're bringing value to your day, and continue to do good out there. And we appreciate all the impact of the work that you do every single day. So thank you all and have a great day. See you. Bye-bye.